Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. Our apologies for the delay. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Today, I'd like to update you on cases identified over the weekend and address some common questions that I've received lately. Since our last update, I am very pleased to see that recoveries have now surpassed the 10,300 mark. I'm sure every one of them has a story to tell. Currently, 66 people are in hospital, including 14 in intensive care. Sadly, I must report 5 additional deaths over the weekend, including 2 at Good Samaritan Southgate Care Centre. One of these was reported by the facility on Friday. The lab has completed more than 26,000 tests since Friday, meaning that we now have completed more than 770,000 tests. We identified 108 new cases on Friday, 101 on Saturday, and 48 on Sunday. There are now more than 1,090 active cases in the province. This is a slight reduction from last week, but we continue to identify a significant number of cases. There is some irony in the fact that my cautious optimism last week was followed by 3 days with new case counts over 100. It is a reminder that COVID continues to be with us, and we cannot turn our backs on this virus. As I said, unfortunately, I am reporting 5 additional deaths today, and my heartfelt condolences go out to everyone who has lost a loved one to COVID-19 or any other cause during this pandemic. I know there have been some questions raised about staffing in place at the Good Samaritan Southgate facility. Managing an outbreak requires significant staffing expertise. It is essential that sufficient staff be in place to support residents with all their care needs and to limit the spread of COVID-19. This is a crucial part of containing any outbreak. After staffing shortages were identified as a possible risk to residents at this facility in late July, as a last resort, an exemption was granted to the single site rule to allow additional staff to support the Southgate Care Centre. I do not make exemptions lightly, but I also need to ensure that residents get the care they need and that it's done in a way that does not put others at risk. This exemption allowed local health officials to address gaps in staffing and help mitigate the spread of the virus. Regular staff of the facility are not working in any other places, and the majority of redeployed staff working at the Good Samaritan are also not currently working at any other facilities. All staff must comply with strict precautions to prevent the spread of the virus outside the facility. This is a serious situation. AHS is working closely with Good Samaritan, and they continue to do everything possible to protect the health of all involved. There have been no new cases identified at this site since August 2nd. Another location we have been asked about is the Bright Path Richmond Care Centre, Child Care Centre in Calgary, where I can confirm that 2 cases have been identified. As with all cases, local health officials have isolated those involved and are conducting contact tracing. Anyone at risk is being contacted. Testing is being offered to all staff and attendees of this childcare centre. These are proven processes being implemented to limit the spread and protect the public's health. The centre was not required to close, but the operator has chosen to do so voluntarily. As I said last week, COVID-19 is not going away. We all need to make wise decisions every day that make life safer, regardless of whether case numbers are rising or falling at any given time. After 6 months, I know it can feel like information overload for many people. With that in mind, I would like to address some of the questions that I have heard recently. I believe that for every person who asks a question, there are hundreds, maybe thousands of people who also want to know the answer. One question has to do with the online map of COVID case numbers in our interactive data app online. The areas on the map can be viewed by municipality or by local geographic areas. Local geographic areas, or LGAs, are organized according to an internal mapping system used by AHS. This naming convention has been in place for some time. However, LGA names were not created with a real-time map and a pandemic in mind. This has led to some confusion about the area names. For example, in the LGAs named Viking and Wainwright, people are asking if all the numbers in these areas are in these towns. That is not the case. I want to be clear that when you are looking at the LGA map, the numbers represented include surrounding area numbers, not just the individual town. Our officials are reviewing the map and renaming Viking, Wainwright, and any other affected areas to make it clear these are regional data and the cases are not all in one community. Another question that I've heard is, why does it take so long to get test results? I understand this concern. I share it. Currently, the average turnaround time for a positive test result to notification is 2 days, and this is too long. We have put some measures in place and are working on more to reduce this wait time and to speed up other components of the testing process in the coming weeks. In the meantime, if you are feeling ill and have been tested, please stay home and away from others in your household or cohort until your test result arrives. Speaking of cohorts, another question I've gotten is whether families should restrict their cohorts once children return to school. Ultimately, there is no single answer to this question. We do know that the more people you come in contact with, the greater your risk of exposure. Parents, guardians, and family members should look at their cohorts and assess if they are comfortable with the current size or if they need to shrink it as school begins. This is a decision that each household must make for themselves. If you are in doubt, I would recommend considering shrinking your cohort for the first few weeks of school and then reassessing once the routines of school have been established. Another question is whether COVID-19 can be passed through breastfeeding. I'm happy to say that there have been no documented cases of transmission through breast milk or breastfeeding to date. However, if a mother has COVID-19 and is infectious, precautions can be taken, such as having the mother wear a mask to minimize the risk of transmission during the close contact between mother and child during breastfeeding. I've also been asked about COVID-19 and its impact on our pets. Research is limited, but what we know right now is that there have been very few reports of domestic animals testing positive for COVID-19. This has occurred after these pets have been in contact with people who were already infected. At this time, there is no evidence that domestic animals can transmit the disease to humans. The final question I want to address today is how to store and clean a cloth mask. I am recommending that you store clean masks in a sealed and clean storage bag in a dry area. If a cloth mask is used only briefly, if it is not damp or soiled, and if it is removed with clean hands, it can be stored in a clean, breathable container and used again by the same wearer. If the mask becomes damp or soiled, it should be put into a separate breathable bag and taken home for washing. When it comes time to clean them, empty the bags into the washing machine. Consider using a bag that can also be washed at the same time. Generally speaking, warm water is better, but follow whatever directions are recommended for washing your mask's material. You can launder with other items and dry thoroughly. There are 3 weeks left in August. Let's all do our best to keep each other and ourselves safe. The best advice for all of us is still to respect physical distancing, wear a mask if we can't, wash and sanitize our hands often, keep social interaction within our cohorts, isolate if we feel sick, and get tested. We are going to be living with this virus for some time, so we must see this as our new normal. Remember that when we take actions to protect ourselves, we are also protecting each other. And as always, we are strongest together. Thank you, and I'm happy to take any questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
versus Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Parents are expressing many questions about the safety of schools as we're about 3 weeks from the head back. As you know, several Alberta schools are quite old. Do their dated ventilation systems put people at risk? Can you also explain how you envision lunchtime at school working in terms of keeping kids distanced from each other?
Thank you. I'm certainly aware that there are many people who are looking forward to the fall and have lots of questions. Of course, with school being closed since March, many of us haven't had our children in school. And with the exception of some summer school experiences, most children are looking forward to this again with a mix of apprehension and excitement is sort of what I've heard that mix is. I think that the important thing as we plan for that back to school is to know that we continue to watch very closely the literature, the evidence around schools. You've mentioned specifically the infrastructure and ventilation. We know that improved ventilation is something that does reduce the risk of COVID-19. And so I think those are questions that each individual school board, as they look at their schools, as they look at the infrastructure, are needing to consider what their options are. You've asked about the lunchtime process. And again, it's not my area of expertise to look at very specific school protocols. So we have provided the general direction with respect to what's expected in terms of managing students. There's some different options that can be considered, such as staggering break times for different groups, perhaps having students eat in classrooms instead of a common area. But ultimately, those are the details that each school board and each school have the time now to work through what they're going to do within their setting and their specific context to make sure that the students are being advised on how to keep themselves as safe as possible. So again, it will be different depending on each individual school, and some of those options are what we've included in the back to school guidelines.
Operator, can you put through the next question, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. We continue to see young people driving new infections in Alberta and really all across the country, particularly 20 to 29-year-olds. Do public health officials need to be changing the messaging for this group, which doesn't seem to be working? And what plans do you have to do that or to otherwise attempt to curb this trend?
It's a really good question. We know that different people receive information differently, and the ability to influence people's behavior is a whole science in and of itself. So we are looking at what we might be able to do to reach out to different age groups and be able to understand what the barriers are to their ability to follow the public health guidance. What are the things that help them, and what would be what are things that we could do to make it easier for them to follow public health guidance? And so there are a few different pieces of work underway that I'm involved in, including focus groups, really trying to understand from the perspective of those particular individuals what those factors might be, and then using their feedback and advice to improve our ongoing campaigns. So this is something that, again, we do all the time with respect to getting our message out and then continually refining and using evaluation and feedback to make it even better. So it is an area of work that's underway right now.
Operator, can you put through the next question, please?
Next is Shannon Scott with CBC. Go ahead, Shannon.
Hi, Dr. Hinshaw. I'd like to talk a bit about modeling today. We're curious to know if the province has an updated estimate of how many actual active cases, including undetected cases, are implied right now based on the number of known active cases that we have. I'm interested in hearing what that might tell us about the likelihood of a COVID-infected student showing up at school once classes resume, and I'm wondering when we might see new modeling.
Thank you. The question of modeling, I think, is going to be informed in the specific context that you're talking about by the July serology results. As you know, we've released the June results that were representation of infections all the way back to the beginning of the pandemic, at least our experience of it here in Alberta. And what the July numbers will help us do is they'll help us to determine if there's a difference between what we saw in June, what we saw in July, and that difference then may help us to adjust some of our assessments or our calculations about how many true infections we might have beyond what we know about from our PCR testing. So I don't have a firm deadline of when our July results will be available. I haven't seen them yet. They're going through the data assurance and quality assurance processes. And once we have those numbers, then we'll be able to answer those questions in a bit more detail.
All right, operator, could you put through the next question, please?
Next is Kenny Trenton with Kix FM. Go ahead, Kenny.
Thank you. Good afternoon, Dr. Hinshaw. My question actually came via a text message from a couple of parents, actually, who are in split family situations as they're prepared to welcome their children back to school. Any advice for anybody living in a split family situation on how to minimize that spread? Thank you.
I think advice to those who are parenting, whether it's a split family or whether it's families who have different people perhaps assisting with childcare after school or on weekends, I think would be communication, making sure that everyone is aware of what the plans are. We know that going back to school, just like when we've opened other segments of our society up, that there will be some cases, there will be some exposures, and I think it's really critical that as we plan for back to school, that families and including the students as well as the parents are having conversations about what can be done to reduce the risk of getting infected, what can be done to reduce the risk of passing to others if someone does get exposed to COVID. And some of those decisions that really need to be taken by individuals and families about the level of risk tolerance, whether there's people in the household who may have chronic conditions that put them at higher risk of severe illness. And all of those things are going to weigh into the risk tolerance of the family and what they think the best path forward is for their children. And certainly some families are going to want to have their children stay home, at least in the early days, because they may have high risk individuals in their household. So honestly, the important thing is that there's really good communication and that everyone is on the same page with respect to how they'll handle different situations, and the best preparation really is talking through all those different scenarios and coming to common ground on how they would proceed together.
Operator, can you put through the next question, please?
Next is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hi, Dr. Hinshaw. In terms of the Good Samaritan Center here in Edmonton, I was hoping you could tell us why the decision was made to allow the exemption over the decision to have AHS take over the facility.
The two different decision points are in some ways not mutually exclusive. So Alberta Health Services, whether they formally took over or as was chosen, they come alongside and partner with the organization to move the outbreak response forward. That was one decision set that's more to do with administration and the kind of flow of accountability. The question about whether or not to do a single site exemption was specifically about whether or not staff who currently work at other sites could come in and support the residents at the Good Samaritan Southgate facility, and also, of course, support those staff that were already working there. And so whether or not a decision had been made to have AHS take over instead of, as was the case, having them partner with a company and bring in teams to help. A single site exemption really was required in this case because the care of the residents was at risk if they couldn't get additional staff to be able to provide the all-around supports that those residents needed. And there weren't sufficient staff within that Good Samaritan Southgate staffing pool who were able to come in and work. And there really needed to be other staff pulled in, otherwise the residents' care could potentially have suffered.
All right, we've got time for 3 more. Operator, could you put through the next question, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi, Dr. Hinshaw. Obviously, school coming up. Some places students are going to be getting their masks pretty soon. What steps were taken to procure the masks? Kind of what went into that process, especially since quality needs to be top of mind because these are going to be protecting students.
The Education Ministry has been working on procurement with the Provincial Operations Centre, and the Provincial Operations Centre has been involved in the mask program that has been ongoing for many months. So some of those basic requirements with respect to quality and the specifications that would be needed were part of that procurement process. More detailed questions with respect to the specifications and those steps that were taken could be directed to education.
Operator, can you put through the next question, please?
Next is Bill Kaufman with Post Media. Go ahead, Bill.
Bill, are you there? All right, Bill, if you want to call back or reach out independently, I'm sure I can address your question offline. Operator, can you put through our final question, please?
Final question is Rashmi Kumar with 580 FM. Go ahead, Rashmi.
Good evening, Dr. Hinshaw. So this is typically considered wedding season. However, there's a lot of confusion about renting religious spaces for private functions. Now, what I wanted to know is what are the mandates in place for such venues, and do the guests have to wear masks, and what are the rules for social distancing at such gatherings, and how many people are typically allowed for such functions?
We do have guidance on social events that can be found on the COVID webpage. So there is actually specific information with respect to weddings, as well as information with respect to, for example, catering and some of those businesses that might be involved in supporting weddings or receptions. The numbers, the maximum numbers, depend on whether a ceremony or the reception is held indoors or outdoors. And those maximum numbers for the actual ceremony itself, where typically people are seated and can be separated from each other, and at the actual ceremony, it's more like a seated event. So indoors, that maximum would be 100. Outdoors, that maximum would also, because of the close family nature of these events, would be 100. So the ceremony itself, that's the maximum. Where the difference comes in is the reception, which again, you'd typically anticipate there would be more interactions, mixing and mingling. And so indoors, a reception for a wedding would be considered a social event and would be limited to 50 people, whereas outdoors, a wedding reception could go up to 100 people maximum. Those, again, that's information that you can find if you look at those gathering guidelines that are found on the COVID website. And with respect to things like distancing, masking, and other protocols that might be required, with respect to the requirements, for example, for mask wearing, that could depend on if there's local bylaws. So, as you know, some municipalities have bylaws in place, and whether or not those bylaws apply, that would be a question, again, to explore with the local municipality to understand what that bylaw applies to. From the guidance perspective provincially, what we would recommend is that distancing be maintained between people who are not in the same household or cohort, and that if that distancing is not maintained, that masks would be worn at that time. That's part of that guidance again. There's also specific information with respect to things like dancing that often happen at wedding receptions, just really kind of concrete things that people can think through about how to keep that gathering safe and to minimize the chance that what is a really happy occasion would turn out to be a place where COVID spreads, which of course is not what anyone wants to happen on that day.
Thank you all for joining us. Dr. Hinshaw will provide her next update on Wednesday afternoon.